about 5G. We've talked about geofencing, et cetera. 2 to 3 years from now, is that just going to be, completely ubiquitous out there? Are we going to be talking about 6G at that point? What can we expect 2 to 3 years from now?
Yeah, right. Well, every year there's a new buzzword in healthcare, right? We've kind of shifted from this connected hospital of the future to more of this connected ecosystem. And so that's really what we're focused on. We're looking at this as an ecosystem, right? We're working, if you're familiar with all the millimeter wave, the spectrum bands that we had purchased from the government, we're focused on, expanding 5G, into more rural settings, so that we can do things like, my parents who ended their lives, after month stays in a hospital could end their lives in the home. So just better connectivity at home, more devices. We're using computer vision to evaluate patients, right? Look at changes in respiratory patterns. Hey, this patient might be in arrhythmia, or even to identify patients who might have COVID, just the way that they're breathing, or the fall detection, to alert clinicians. So I think what I'm most excited about is just more ability for care at the home. And then access, and certainly growing up in naval hospitals, I know about the challenge of access, right, within those institutions. And so we're doing a lot around like kiosks. Imagine a kiosk that's more than just a blood pressure cuff, but actually has telehealth ability built into it. Dr. Evans talked about the Affordable Connectivity Program, as did I. Imagine this kiosk where you could fill out, applications for Medicaid, for the hospital's charity program, whatever, what have you, medication lockers. So, and putting these in grocery stores, putting these in areas where people frequent. So that's going to be exciting to help improve access to our healthcare system.
And we